Things like construction, like manufacturing, you have no choice. You have to be on site. But you know, a lot of the senior executives, especially in the services industry, there's no reason why they need to go to the office. And sometimes people go to the office just because you want to, you know, see that your subordinates are working. So this is actually going to change the whole nature of work, I think, for a lot of people. There's good and bad points. Good point is flexibility. You know, you don't have to fight traffic. You can wake up at 7:45 for an 8 o'clock meeting. The bad points is that sometimes you're always working, you know, and then so the boss feels that he doesn't see you, but he can still send you a task to do. And so it's very hard to sort of draw the line. I mentioned the third booster, and frankly, very few viral infections actually need a third booster. The exception is the flu, where you need to get vaccinated every year, and that's because the virus mutates. Now, recently, I've had a couple of patients who had the MMR vaccine, and then they were tested, and then they were found to have low levels of antibody. So the recommendation is you give them one booster dose, and then you don't test them again. Because again, every vaccine is about 90–95%, most of the commercially available vaccines, 90–95%. So what that means is 5 to 10% of people are not going to have a good response. So I don't think there's going to be a need to boost everybody, but there are some people, maybe those at high risk, see those who are going to be working in Changi Airport or the harbor, then, you know, we want to make sure, and now we can actually measure their antibody level, so we can see how protected they are from the virus. So some individuals, we may need to give a third booster, but I certainly don't think that's going to be the case for everyone. This has actually been the case with a number of the Tan Tock Seng cluster. The first test is negative, then the second test a few days later is positive. But by the time they're symptomatic, usually by the second or third day, they're positive. So as I mentioned earlier, the PCR is not 100% sensitive. And it depends on your clinical judgment. So if the patient is still having symptoms, if the fever won't go away, then you should certainly do a second or third test. And as I mentioned, there's a publication from Tan Tock Seng, NCID, where they showed you needed to test somebody 4 or 5 times before you found out that they actually did have COVID. You'll notice that now the community cases are more than the imported cases. So they have put in very strict regulations, you know, and this is for every country except for a tiny handful: Australia, New Zealand, Hong Kong, Taiwan, Brunei. So we have colleagues from the US who are here on an employment pass, and they dare not go back to the US because they think they won't be able to come back to Singapore. So, you know, all their summer vacation plans with their family, even though in the US they've opened up, but those who are in Singapore are staying here. See, they're not willing to run the risk of going there and not being allowed back into Singapore. So there are some measures which have been put in for imported cases. Don't know whether they're too late, but they're certainly in place already. So I don't think there's very much else they can do short of completely, you know, shutting the borders and arranging for evacuation flights for Singaporeans and PRs. You know, I just read a report. There's a prison chef who turned positive. And we had a case last year when there was somebody in the prison who was positive, but this was somebody who was kept in a single cell. So I think prisons are a major area. You know, people in Singapore don't think about the prisons. Prisoners are invisible. You know, you have this yellow ribbon project, and then once in a while you think about them, but the rest of the time, you know, it's so much stigma that they are way under the radar. But across the world, in Thailand, you know, the big outbreak right now is occurring in the prisons. So I would say the prisons are a major potential blind spot that we have to be really, really careful about. I'm not a fan. You know, as I mentioned earlier, there are 2 schools of thought in the medical and scientific, the close contact versus the airborne, and I'm more on the close contact side. But on the other hand, the air purifier can reduce, I have a very sensitive nose. And so the air purifier removes a lot of the dust particles. And so maybe, you know, it reduces people from sniffing and sneezing. So if the guy has mild COVID and you prevent him from sneezing, you're preventing him from spreading the virus all over the place. So from that point of view, rather than from the point of view of just specifically killing the virus, I think, you know, just probably a small benefit, but not a huge amount. This is a very controversial thing, and this came up during the WHO visit to China to study the origins of the virus, because the PRC government is trying to argue that this virus came from outside on frozen food and went into China. Now, there's no evidence that the virus can spread from frozen food and infect people. They can find the virus on frozen food. In fact, there was a study that was subsequently retracted from Singapore where they showed that you could culture the virus on frozen food for a very long time. But, and virus has been found on frozen and meat packing plants in the US. But whether it's from infected person infecting the food or the food infecting the person, it tends to be more person spreading virus, shedding virus onto the food. And whether the virus can go on to infect somebody from frozen food is still not proven. It's not impossible, but I would say it's relatively unlikely because, the vast, like for example, in Singapore, the dorm outbreaks, the vast majority of them don't handle frozen food, but they got infected because somebody in their room was infected. Like I said, if Sinovac was the vaccine, the kill vaccine was made by any other company which has a track record of exporting vaccine, I would be the first in line for it. But the trouble is that the regulatory procedures, Sinovac has tried to get Singapore regulatory approval for a very long time, and it still has not been approved by HSA. So, so that is a concern because HSA is quite stringent. They follow international standards and they require primary data which they review. So I wish that Sinovac would have that data because there seems to be real world evidence from like Indonesia where they've used Sinovac and it seems to be relatively effective in what they have done. But again, we haven't seen published data in the peer-reviewed literature, and we haven't seen data that satisfied HSA. So that's a pity. I know many older people, like I said, people get vaccinated for travel, and China says they'll only accept Sinovac or Sinopharm, so they are waiting for Sinovac to get approved. But it's taking a really long time. And so, I hope that they will just provide the data and then we'll get the approval soon. My understanding from the last HSA statement is they are asking Sinovac for data and Sinovac hasn't provided them the data. So the data is from that end. We haven't heard the details about which variant is involved with the Changi Airport cluster, except from the press release about 3 or 4 days ago where they said that they had identified the B16172 variant as the cause of the Tan Tock Seng cluster and a different variant, but a subset of 1617. So presumably either 16171 or 16173 as the cause of the Changi Airport cluster. So it is probably one of the variants, but a subset of one of the variants. Now, when it comes to a finger peer, my understanding is like, when you go and collect your bags, all those from a certain number of gates, they will end up at the same conveyor belt. And it's quite self-contained because they go through the same sort of toilet area, there's the same sort of screening area. So there's like 4 or 5 belts that are together. So I don't think it's possible to pinpoint one particular, place of origin for that belt, given the fact that Changi Airport, there's such a few flights coming in all together. But we still don't know, you see, whether there was a single super spreader, somebody who was highly infectious and then spread and then infected the whole of the Changi Airport cluster, or whether it was multiple introductions. But we will know the answer once the genetic data is processed. Because there's a difference. See, if it's one person who brought it in and then, unfortunately like SARS, there was that one woman who brought it in and all the subsequent strains were related to her virus. So if there was one person on one flight who was a so-called part of a super spreading event, then we will know. Because all the Changi Airport cases will be very, very close to each other. It'll be like the hepatitis C, where all of the cases of hepatitis C and SGH were almost identical. There was only 1 or 2 mutation differences, which is very different from other hepatitis C outbreaks where you get multiple different strains involved. Right now, there are a few things. 1, Sinovac is not licensed in Singapore. 2, the vaccines are free, so they're not going to pay for a 3rd jab. So you probably have to wait until it becomes commercially available. And that would be like a booster, in fact, one of my patients, he received 2 doses of AstraZeneca overseas. But too bad it was too late because he got exposed to the virus and then he came down with it. So he said, should I get a 3rd dose of Pfizer because AstraZeneca is not available in Singapore? So I said to him, let's just wait for you to recover. We'll do some blood tests, we'll see your antibody levels, and then we can have a discussion. And of course, we have to appeal to MOH because MOH currently controls the stocks of the Pfizer and Moderna vaccines. They haven't made it available for private sector or GPs just yet. So, but theoretically, there's no good reason why it shouldn't work. And in fact, there are studies being done in the UK where they're doing this mix and match of AstraZeneca and Pfizer and trying to see whether they work. I think that, you know, the public really needs to think about this question about where we are going. See, are we going to continue with this aim of going to zero COVID, or are we going to be prepared to accept a few mild cases here and there? There's of course a few considerations. See, if in order to do the living with the virus strategy, we must have enough vaccine to be available. So I think what the public needs to do is they need to have honest discussions. We need to try and get some data from the government, you know, as to how much vaccine is really available. Is it true that if everybody wants it under the age of 45, they're going to be able to get it? And, you know, this is a mindset change. See, are we prepared to accept a small number of mild cases in exchange for you know, being allowed to open up the economy, going to a restaurant, going to a hawker center, and all that, you know, and meeting our extended family again? So these are very serious discussions. They are philosophical discussions. They're not just medical and scientific discussions. And I'd like to encourage your readers, your writers to start thinking about this. See, like I said, my colleague, Dr. Su, in his piece in the Today, yesterday, 2 days ago, he sort of highlighted this issue of living with the virus. And we have to start thinking about it. See, we still don't want to have deaths. We don't want to have severe cases, but whether we can tolerate a few mild cases. I think that's a conversation we have to have. I think, you know, a lot of countries are talking about this as an opportunity to rethink the whole nature of work, the whole nature of business. You know, my wife is really upset with me. About 10 years ago, I flew to Frankfurt, spent 12 hours at a meeting and then flew back the next day. She said, you know, you're killing the environment. I said, yeah, I know. So, you know, that kind of thing cannot happen anymore. So the nature of work has to change. But for Singapore, the most obvious thing to me is this over-dependence on foreign workers. And it's not good for anyone. You know, it's not good for the foreign worker. They come here, they get exploited, they get treated very badly on the assumption they're just going to come here for 3-4 years, make some money and go back. And it's definitely not good for the locals because it depresses wages. This has been shown all around. And so I think, you know, that is a serious issue which the whole nature of our economy, and not just the construction, marine, and processing sectors needs to be examined. Walter Teixeira talked about this, caregiving. See, because it's so easy to outsource caregiving to foreign domestic workers, you know, the whole home nursing segment has been priced out of range of most average middle-class Singaporeans. So you know, that needs to change. And that can change very quickly with appropriate government intervention, with subsidies that are targeted. And I think if we don't, when the next pandemic comes, we're going to be back to square one or even square minus one.